What is the difference in a bulging disc, a herniated disc, and a ruptured disc? Do you even care? Well, if you have back pain and you got an MRI and you're not sure what the MRI says, you probably care. But I'm going to show you, this is an example of a bulging disc. If you see that center there, that little nucleus, that center area is sticking out a little bit. It will put pressure backwards on the rest of the disc, and therefore can put pressure on the nerves sticking out. So that's a bulging disc. You see how much that nucleus of the disc has changed there. That would be a simple analogy of a bulging disc. This would be more of a herniated disc. You see that part has lost the jelly is sticking out of the donut, so to speak, and it's putting pressure, could put pressure on the spinal cord or again on the nerves that come out of there. So this is more like a herniated disc. And a ruptured disc is when that part right there actually becomes detached from the inner part. There's no bridge there anymore, and that's a ruptured disc. And one of the things I'd like to tell you is there's some research that has come out, and there's more and more of this research coming out that says just because you've been diagnosed with a herniated disc or a bulging disc or even a ruptured disc does not mean that you're going to need surgery for that. There's actually a lot of research that says your immune system will start to eat up that bulge or that herniation, mostly the herniation, that herniated area. The immune system will go after that and start to eat it up so that it doesn't stay there, irritating the nerve. So now that means you have to have a good, healthy, functioning nervous system, but it also means that just because you're diagnosed with a herniated or bulging disc or a ruptured disc does not mean you're going to need surgery. It may mean that you need to do the right therapies and the right modalities, taking care of your inflammation levels. But the research says, hey, we're doing way too many surgeries. Not only are we doing way too many surgeries, but the surgical success rate is pretty poor. It's about 50%. I even had a neurosurgeon that I interviewed one time, and she told me that that's what the research shows, that's what's published, but the failed back surgery rate is closer to 75%. She wants something with a higher success rate. So things like decompression therapy, joint mobilization from an osteopath or a chiropractor, rehabilitation, proper functional exercises and physical therapy, lots of other modalities. Anyway, hope you found this helpful. If you're suffering from back pain, if you have been diagnosed with a bulging disc, a herniated disc, or ruptured disc, I hope you learned something here. And I hope for you that maybe you could do something about your condition without the use of drugs and surgery. I'm Dr. Dave Morris of Magnolia Medical Center. Have a great day.